since you asked about the IP waivers, let's start with that. I think there are two types of problems that are sought to be solved. The first is the most immediate problem of vaccinating the people, and the second is a problem around long-term access. And I'd like to, encapsulate both of these in the whole topic of access. And I think I'm not so sure that an IP waiver at this stage is something that can solve an immediate problem. I think it may be able to solve longer term problems, but the immediate problems perhaps need to be solved by more collaborations like what we've been having with the rest of the large pharma players. And there are templates that exist for this in partnerships that have already happened. So I think if we were to step back and solve for access, that's a better goal to solve for, and that'll allow many things to sort themselves out. So the IP waiver can be argued both ways. We're more about creating access at the immediate moment because I think that's the need of the hour. And therefore, our objective is that there should be more partnerships to be able to bring more vaccines into parts of the world that currently don't have that supply.
So my only follow-up there is, I understand where you're coming from, and that's, like you said, one part of the argument. The other side is, would access, just simply access, solve the problem, given the urgent need that we are seeing in developing nations, not just India, Brazil, Africa, ASEAN. And, Roche, on its part, in an official statement, said that the production process for its medicine is very complex. That's a line of thought that we've heard earlier on from the Pfizer CEO as well. Is that your view, too, that the process is complex, given that you deal with a lot of off-patent drugs?
So I think there are different types of products. So let's go by conventional vaccines that are made more in the developing world. I think the likes of the vaccines that are made by AstraZeneca, the likes of the vaccines which are more adenovector based. I think those technologies exist. They exist in several countries, and India certainly is a powerhouse for manufacturing for several of these, and through the companies located within India. But there are also these new technology vaccines like the mRNA, et cetera. And I do believe that manufacturing for these is complicated. I do believe that there exists considerable know-how. And it's not just about IP, but it's really about that technology and the experience that companies have had in formulating that technology. And I think, if you were to even take this to the conventional side of medicine, that in the side that we are, I think it's quite apparent that the basic attribute of nanoparticulating anything so that it can reach the human body and create the spike protein. That's not a really simple science, because even when we are trying to create these nanoparticle-based injectable products which are non-vaccine, there aren't too many people who can do it. So I do think that there is considerable know-how that still exists with companies that have developed the latest vaccines in the market.